Hello everyone, welcome to today's session of Clinical Pharmacology. In this video, we will discuss one of the most important and repeatedly asked concepts in MD pharmacology, the P-drug concept. This concept forms the foundation of rational prescribing in clinical practice.
Definition: a P-drug, or personal drug, is defined as the doctor's preferred drug for a particular disease, selected on the basis of objective criteria before encountering an individual patient. This definition is recommended by the World Health Organization.
Please note the important keywords in this definition. Preferred drug, for a particular disease, selected before seeing the patient, based on objective criteria. These words are extremely important for theory and viva answers. A P-drug is not a drug chosen for a specific patient. It is also not influenced by medical representatives, brand popularity, or personal bias. Instead, it is a scientific, rational, pre-decided choice. The P-drug concept was introduced to combat problems such as irrational prescribing, polypharmacy, increased adverse drug reactions, high treatment cost, poor patient compliance. The main objectives of the P-drug concept are to promote rational drug use, to standardize prescribing behavior, to improve patient safety, to ensure cost-effective therapy, to enhance therapeutic outcomes. According to WHO, a P-drug is selected using 4 objective criteria: efficacy, safety, cost, suitability. These criteria must be applied systematically and comparatively. Criteria 1. Efficacy refers to the ability of a drug to produce the desired therapeutic effect. It is assessed using clinical trial evidence, treatment guidelines, standard pharmacology textbooks. The most effective drug need not always be the newest drug. Criteria 2. Safety includes adverse drug reactions, contraindications, drug-drug interactions, use in pregnancy, lactation, elderly, renal and hepatic disease. A slightly less effective but safer drug is often preferred.
Cost refers to the total cost of therapy, not just the price of a single tablet. This includes duration of treatment and affordability. Cost consideration is especially important in developing countries. Suitability considers patient convenience, including dosage form, dosing frequency, route of administration, and likelihood of patient compliance. Once-daily oral drugs are generally more suitable. A P-drug is a standard drug for a disease. A prescribed drug is patient-specific. After selecting a P-drug, it may be modified according to age, pregnancy, comorbidities, and organ function. To conclude, the P-drug concept transforms prescribing from an art into a science. It ensures rational, safe, and cost-effective pharmacotherapy, the true goal of clinical pharmacology.
Let us understand the WHO P-drug selection concept using a real clinical scenario. This is the case of Mr. Avik Das, a 30-year-old marketing executive presenting with epigastric pain, burning sensation, and heartburn. He is a smoker, consumes alcohol, lives under high stress, and follows an irregular diet, all strong risk factors for gastritis.
On examination, epigastric tenderness is present while vitals remain normal. Endoscopy reveals antral gastritis and Helicobacter pylori test is negative. The patient has been self-medicating with random antacids, but without relief. The question now is, what is the most rational prescription?
To answer this, we apply the WHO recommended 5-step logic filter for P-drug selection.
Step 1 is defining the diagnosis. In this case, the diagnosis is antral gastritis,
precipitated by smoking, alcohol, spicy food, and stress.
The therapeutic objectives are to relieve pain and burning, heal the gastric mucosa, and prevent recurrence, such as GERD or peptic ulcer disease.
Next, we list the effective drug groups. These include proton pump inhibitors, H2 receptor blockers, antacids, and mucosal protective agents. Drug group selection is based on 4 criteria: efficacy, safety, suitability, and cost. Proton pump inhibitors provide superior acid suppression, once-daily dosing, and excellent safety. Other groups are less effective or provide only symptomatic relief. Therefore, proton pump inhibitors are selected as the most effective drug group for this patient. Among proton pump inhibitors, we now choose the most suitable P-drug molecule. Most PPIs are metabolized by the CYP2C19 enzyme, increasing drug interaction risk. Rabeprazole is an exception, with minimal CYP2C19 involvement. Rabeprazole offers high efficacy, superior safety, minimal drug interactions, convenient once-daily dosing, and good cost-effectiveness.
The final prescription is Rabeprazole 20 milligrams once daily, taken on an empty stomach 30 minutes before breakfast for 4 weeks.
Abrupt discontinuation of PPIs can cause rebound acid hypersecretion. Therefore, treatment duration should be limited and tapered if required. This case demonstrates how the WHO P-drug concept ensures a rational, safe, and cost-effective prescribing in real clinical practice.